The official start to spring is just about a week away, and this time of year makes many of us think about wearing a little less clothing and even bathing suits, and we wonder how our bodies will look less covered. So today we're talking about summer-ready procedures with Dr. McIntyre Bridges from Bridges to Beauty. He'll be answering your questions for the next half hour. We want to encourage you to ask what's on your mind. If you're online, just click on the orange Healthline 3 box about halfway down the right side of your screen on KTBS.com. Type in your question and submit it, or just give us a call at the number there at the bottom of your screen. It's 318-219-4569. We'll be taking your questions until 12:30. Thank you so much for being with us today, Dr.
Carly,
Bridges.
thank you.
So it's almost summertime, still a few months away. It's a good time to start thinking about your body and how you want it to look when you go to put on a bathing suit.
Yes.
And so there are a couple different procedures that people think about getting this time of year, which is mainly breast augmentation and also liposuction. We're going to cover both of those today. But let's start with breast augmentation. There are several different types for women and men. What are the differences?
Well, in women, obviously, there's the breast augmentation with implants. Presently, the most common implants I'm using is the silicone gel, just because the feels better. We tend to hold up on the chest wall a lot better. But you know, the women who get it, things are after really proportion. I mean, I get some that want them a little bit bigger than I like them to be, but that isn't the most common. It's probably less than 2%. Most people want to fit well in their bathing suits, look good in their clothes, be proportioned from the top and the bottom. Those are all good things. In men, it's the opposite. I mean, men I see, and this is really a busy time of year for both of them, where they have a little subcutaneous mastectomy because they have too much breast tissue. It's a good operation. It'll do what it's designed to do, and it gets rid of the breast tissue that men typically get. Men and women have breast tissue. It's just that some men will develop more due to hormones or just naturally, and so they want what's called subcutaneous mastectomy, or where you make an incision around the nipple, take out the extra tissue, so that they look better, and they don't have to wear t-shirts during the summertime.
We already have a few callers at this point. The first we're going to take is from Judy. Thanks so much for calling, Judy.
Yes, I'd like to know about Restylane injections, how the cost of it, how long it lasts.
Okay. Well, Restylane, I don't use much of that anymore because it didn't last very long. I mean, it probably lasted about 3 months in most people. Well, the ones that last longest are the Juvederms and then Radius. Radius is different from the Juvederms in that the Juvederms are hyaluronic acid. It's the same substance that's found in your joints that lubricate it. They've just modified it to make it structurally sound, so that it sticks around longer and your body doesn't dissolve it. The Radius basically it's little calcium particles, and structurally it's very, very good for nasolabial fold regions. I don't use it in the lips because it feels a little bit firm. But cost on the Radius is probably $600 right now. We got it like for $520, and that generally takes care of nasolabial folds on both sides. Your Juvederms will vary in prices based upon the type. There's really two types. There's a Juvederm Ultra and then Juvederm Ultra Plus. And then of course you have the Voluma, which is for the cheeks, but this is a type of Juvederm. It's probably the most expensive. It's about $800 per syringe. And most people, when you're doing cheeks, are going to use 2, maybe 3 of those things. But for the lips, you're going to use the Juvederms, probably the Ultra. And it probably runs about the same thing as your Radius. Is that good enough? Any more?
Does that answer your question, Judy?
Yes, it did. I appreciate it.
Okay.
Thank you so much.
You're welcome.
Sure. Thanks so much. For other people who may be watching, who want that type of injection, the Restylane or whatever other options you were talking about, tell us just a little bit about what areas of the body you would use that on.
Well, the FDA has approval for certain locations like the Radius, it's nasolabial fold regions. but we use it, off-label. Like if someone has a demarcation between their jowls and their chin, they have that little sunken area to make the jawline a little straighter and more uniform. We put it there. You could use radius for the cheeks. Ultimately, it's probably a little bit cheaper than the Voluma. It has a life of about year and 2 months, whereas the Voluma, according to the FDA, because you really can't say certain things unless the FDA approves it and has confirmed it, it'll last 2 years in the cheek regions. That's probably one of the reasons it's so expensive. It's just basically if it lasts longer, it's going to be more expensive.
Doesn't necessarily go along with the summer ready procedures we're talking about, but people have all kinds of questions about how they want to look in the summer, and they want to improve all types of their body.
Ask anything, yeah.
Yep. Our next caller is Lorraine. Lorraine, thanks so much for calling. What's your question for Dr. Bridges?
Okay, hi.
Hey.
Dr. Bridges, I may have missed the nature of the subject. I thought you were speaking of lipo or bariatric surgery, but listening in to your other callers, feel like you might be talking about breast augmentation. Did I miss it?
Go ahead. No, we're talking about breast augmentation, liposuction.
No, I thought you were talking about lipo or bariatric surgery.
Well, the bariatric surgery I don't do, but I usually take care of. Well, I take care of the people after they've had it. Like say if they
I got you.
lost weight and things, we do the contouring, we do the body lifts, and we'll do liposuction too. In my office, I do primarily smart lipo, which basically gives us the best.
Okay, that's what I thought I heard you say when I was surfing the channel, smart lipo.
Yes, ma'am.
And one of my question was initially was, I am a diabetic, type 1 diabetic, and I would love to have the type of surgery for that reason because I am diabetic to lose some weight. Would I be a candidate for that surgery, type of surgery? Just speaking of the smart lipo.
Well, how much do you weigh?
A lot.
It's probably not appropriate to ask a woman how much they weigh.
200.
Okay, all right. Now, it depends upon the area that you're having lipo. I mean, typically, if you're talking about the abdomen and
yes,
it's been,
most definitely.
Have you had kids?
No.
Okay, all right. Is the skin stretched out or anything? I mean, in terms of stretch marks? You have stretch marks on the abdomen?
I apologize. I didn't understand you.
I mean, do you have stretch marks on the skin of the stomach?
No, I do not. I have some in my thigh area.
Okay, all right. But when you talk about any type of liposculpting, smart lipo, regular lipo, you always have to take into consideration the skin quality over the top. Because what you're doing with any type of those is you're deflating a balloon. If the balloon's been overblown, then basically it's it might be better just to take the skin off and do some lipo at the same time. Because again, it's no one's got a crystal ball, so it's it's difficult to say how that skin's going to react afterwards. You can get the fat out; that's not an issue, but how the skin's going to react is the question that's unknown. If the skin's been overstretched. It's always good to come by and do a little consultation. I can tell you exactly what, because over the phone you just can't see anything.
Sounds good to me. Thank you very much, doctor.
You're welcome.
Lorraine, thanks so much for your question. And that is a good point. If you do have any questions, obviously we'd like you to call and the doctor can address them, but they can always come in and get a consultation, right?
Absolutely, yeah.
For whatever
That's probably the best way to do it. Like I say, I don't have, the vision to see her, and it's better to see her just in person and give her the best options for them. They might choose the smart lipo, but there's nothing that's a silver bullet. And again, the biggest issues that you have with any type of liposculpting, smart lipo, regular, or power-assisted lipo, I use all three of them, is how well that skin's going to act. And it usually is reasonably predictable that if it's overblown, it's not going to snap back like you'd want it to. The advantage to the smart lipo is it does tighten up skin, so it's helpful in that respect. But there's nothing that's a silver bullet.
What makes it smart lipo? What type do you do, and can you just explain the procedure to us?
The smart lipo basically is a laser-assisted lipo, and the value to it is that just like with any other type of lipo, it will kill the cells, the fat cells. You really want to eliminate the fat cells. you want to break up the structure of the fibrous tissue that fat lives in. And I find that the Smart Lipo does the best job with that. Also, the big advantage of it is it's because it can heat up the skin from underneath. It can actually tighten it, and there's no other type of lipo that can do that. So I've been using the Smart Lipo for 6 years. Really enjoy the results. Couldn't be more pleased with it. And again, it's an in-office procedure, so compared to going to a surgery center, it's much cheaper than you'd find with other options.
How long does that last? Because someone, may like the results and may think again, I can eat whatever I want, or I can do whatever I want after this. Does the fat come back?
Well, in the areas that you lipo and things, you're going to have some that comes back. But the issue is we got to maintain our weight, because your body will find some place to put it. Typically, the areas that you're doing Smart Lipo on, or any other types of lipo, are areas that are problematic for that person. And even though the fat cells underneath the skin all over our bodies look the same underneath the microscope, they certainly behave differently. There's certain areas that you have genetically that you inherited from your mom or your dad's side of the family, where your body likes to put it first and give it back dead last. Flank region is probably the most common place in men and women where that happens. Okay, in women, secondary areas is the lateral thighs, or actually the whole leg regions, where they're trying to lose weight and things, and they can't. That just doesn't come off until the very end, when they look like they've been in a concentration camp. And then they don't look good because they look like they've lost too much weight. So it's best to get it's very helpful in getting the contours you want if you do like the Smart Lipos for the best overall shapes. We're the only ones that have the Smart Lipo. It really kind of in the architects but I've been very pleased with it.
What parts of the body do people like to Smart Lipo in men as opposed to women? I'm sure it's different parts of the body. Yeah,
men is primarily the flank regions. Okay.
When you say flank regions, what do you mean exactly? Like kind of like your back and your butt?
Lower portion of the back. Yeah. And then the second most common place, and usually they do it together and things, is the abdomen. And then if they don't have a great deal of true breast tissue in the chest, they'll do it there too. But I'm not the biggest fan in the world of doing Smart Lipo even in the chest region, because part of that fullness is there is actually breast tissue, and if you had an analogy for it, it's like gristle in a steak, so it doesn't liposuction out. Well, you can get it smaller, but they're probably better off having the gynecomastia with the resection of that tissue.
Okay. We have another caller right now. Barbara has a question for Dr. Bridges. Barbara, what's on your mind?
What would be the best procedure for under the arms, the flab?
Well, again, that's issue. Like I say, it's good to see the person first, but some people can have the Smart Lipo. Other people actually need to have it resected. And again, it all boils down to the elasticity of that skin. If it's hanging, 2 or 3 inches below the triceps muscle, then probably a resection would be better with, liposuction with that. I do them in combination when I have to tackle that. The reason being is that, if you did just lipo by itself, even Smart Lipo, even though it can tighten up the skin, we don't want that skin just hanging. And it's better for a consultation, so I can weed out those factors, because again, it's a skin elasticity issue.
Okay.
That helpful?
Thank you very much.
Thanks so much, Barbara. So with the Smart Lipo, when you go into the skin, does that leave scars, or what can people expect when it comes to that?
Yeah, but they're about half the size of my little fingernail. It's just a little puncture wound. Everything else is done underneath the skin. They heal up very well. I generally, when I do it, again, it's an in-office procedure. You come in, have it done, go back. You have to have someone take you home. But I leave the little holes open. Okay, so they'll drain about 12 hours or so, and it's just kind of this watery, a little bit pinkish looking stuff. The reason being is, underneath the skin, I've turned that fat into the holiest Swiss cheese you've ever seen. Okay, actually, there's not much cheese there, and the rest of it's fibrous tissue. And so, because everything I do, I don't care what surgery it is, thinks all surgeons beat up on people for a living. That's what your body thinks. It doesn't know why it's happening. Okay, it's like, Your body's sitting there minding its own business. Somebody takes a knife to it, it's either mugging or surgery.
It's being assaulted. It doesn't know that you're doing it for the better, to look better.
Right. You know, I know, it doesn't. Okay, so it will always do what it's designed to do. And so it's going to have some swelling. Where those little holes are, the swelling that goes into those tissues will leak into that space. And to avoid fluid collection underneath the skin, we leave little holes open. If you put a stitch across it, you're going to get fluid collection, and that's a problem. Because you want all those tissues stuck back down together to prevent that. So, you know, it's the nuisance factors associated with it is the fact that they leak for about 12 hours. No one really calls me for that because they understand that going on. They'll see a difference right off the bat, but that's a difference with swelling. Okay, and as it heals, like any other injured area, it takes about 2 months, 3 months to kind of get all that swelling out of there. You know, most of it's out by about 4 weeks.
That was my question, the recovery time. So it is months to be totally healed, but you do see a difference right away?
Yes, you'll see a difference right away because you've gotten the bulk out.
Is it bruised?
Typically not. We do want people to not take any aspirin for at least a week before. If they take ibuprofen or naproxen or some type of Aleve, you want to stop that at least 3 days before because it thins the blood and those people will bruise more. Lower extremities, if there's any bruising, is probably the most common place to see it because it's the most dependent. There's more venous pressure. There's reasons for that. Okay, so around the abdomen and flank, it's not that big a deal. On the back, occasionally they'll get little bruises because you have to be very aggressive there because there's more fibrous tissue underneath the skin.
Okay, we're talking summer-ready procedures here. Earlier in the show, we touched on breast augmentation a little bit and then jumped to that smart lipo. But I want to ask some more questions about breast augmentation. We talked about men versus women. But when it comes to women, we think in the summertime, you know, we may want to get bigger breasts. But people also want, you know, a reduction, sometimes to look better, depending on how big they are. What percentage of people do you see wanting to go bigger versus going smaller?
About 1 in 20 won't go smaller.
Really? Just 1 in 20? Mm-hmm. Wow.
Yeah. I mean, it's yeah, most of them want to go bigger. I'm seeing a skewed view of it, though. You know, I've been doing the breast augmentation for 30 years. You know, it's a real popular procedure. I'll see people coming in with anywhere from A to a small C that want to go larger. I really coach them into shooting for proportion versus what I call a novelty.
And when you say proportion, you mean along with the rest of their body, how tall they are and how curvy they are? Is that what you mean?
That's correct. The biggest issue when it comes to breast augmentation is the fact that we have to talk in A, B, C, D cup sizes. Okay? But that's not really the issue. The issue is, do it look proportioned? And you get people in all the time and go, I want to go from A to a C. And they're, you know, 5'9". They have real wide shoulders. They're, you know, let's say they wear a 34, but to me it looks like a 36 because they're flatter this way. It needs to match up to what it looks like versus what, you know, the circumference says, because they just don't understand that basically this is the frame, okay, the shoulders, width of chest wall, and the height. The picture needs to match the frame. And so you know, the ones that always make me cringe are the ones that comes in and, you know, they're an A or B and they just want to go in that kind of C range. They're afraid of that D word, even though D is not much bigger than a C. And so I'm trying to give them the best overall result based upon proportion. And so I'll push it a little bit towards the top part of that, but I'd really just rather have them let me decide. When they come in, they'll say, well, what size is the implant you can put in? I say, I'm not going to tell you. Because I don't know. Because everything you see on the outside is some of the shape of the ribs and everything stacked on top, and the ribs aren't the same. And I learned that a long time ago just because, you know, with the salines and stuff, at one point that's all we had. And I'd say, well, we'll put this size on this side and this number of cc's on this side, and I'd fill this up a little bit more and leave this the same. Because no breast is exactly the same size from one side to the other. And even though you got a great result and things, they come back with that little card that says, oh, you told me that, you know, you put a 300 on this side and filled it up to this, but you put a 300, but you only filled it halfway. You know, we're talking about like cc's, like 15 cc's. That's a little over a teaspoon. I mean, it's not much a bigger difference. But people fixate on numbers. So in order to avoid that kind of questions and enigmas and things. It's just best to let me do what I need to do.
The most important thing is that it looks good, not necessarily, like you said, the numbers, how much you fill it up, what your cup size is, just that it matches.
Right.
Oh, all my papers are gone there. Just that it matches what the rest of your body looks like, pretty much.
Yeah, because that's what the brain looks at. The brain looks at two things when we see anything: proportion and symmetry. Okay, and no one takes into account the frame, and that's really, if you have a small picture in a big frame, that's just not going to look proportioned. You need to kind of fill it out. Again, you don't have to be a novelty or first thing coming around the corner, which again I kind of talk people out of or talk them down from those things. Because again, all novelties wear off. I mean, breasts live off the edge of a cliff all their life. Which direction is that going to go?
Right.
So stay within reasonable ranges and stuff, you'll be happy. Stay for proportion, you'll be happy. Don't come in saying I want a certain size, because again, I'll help you decide. Okay, but I don't like people come back saying, "Oh, I wish I would have gone larger." When I knew they should have gone larger.
And it's great that you can help them decide. You have so much experience with this. How many women do you see a month getting breast augmentation?
Well, like this week, there's been 1, 2, 3, 4, 5. For consultation, just this week, I've probably seen about a dozen.
Wow.
As far as the operations go, I've done 6 so far. I've got 2 for Friday. Then I got a tummy tuck and I got a smart lipo. So again, it's a busy time of year, but those aren't unreasonable numbers.
You just mentioned a tummy tuck there. We talk about smart lipo and we talked about breast augmentation, but that may be something that people are looking into to get ready for summer. What does that entail?
A lot more, but again, you're absolutely right. I mean, I probably do 2 tummy tucks, 3 tummy tucks a week. They're long operations. I spend time, correcting issues I think that are important. Most of them are women who have been pregnant, and for 9 months times how many kids they've had, the body's only job was make room for the child, give it some milk. And that means that usually the muscles have to spread to do that, because they're out like this. I mean, the muscles can't stay the same. And then the skin suffers because it loses that elasticity. I mean, that's what stretch marks are. Stretch marks are dermal tears, and where it's the leather portion of the skin tore to make room for the child. And those are the people who really can't do smart lipo, just because they won't like the results of the way that skin redrapes, and it looks more crinkly. But in tummy tuck, my goals are get all those muscles back to where they used to live prior to pregnancy. Get the curves back in shape as far as even the muscle, and then take off all the extra skin, and then a liposuction on the lateral portions to get even a better curve. But it's getting the muscles back to where they used to live is the most important part. And I do more. I essentially knit a girdle underneath the skin. Most will just tighten the midline. I never felt that gave me the best results. Okay, so I probably spend a third to half the time just tightening muscle, and everybody's a little different. I mean, they stretch out in different ways so many times. And as far as the skin goes and stuff, everything below the belly button is going to go. And I also make the incision site real low, because you can cover that up. I mean, if you make them where it's halfway between the pubic region and the belly button, there's no way you can cover that up. So I like them low. The length of incision is where their body tells me to stop. Okay, it's not predetermined, because if you stop too early, you get what is called dog ears, which are just little pucker areas that no one likes. So just let me chase it out to where it needs to go. But tummy tucks they're real common. It is the most uncomfortable operation I do, because anytime you deal with muscle, kind of like with a breast augmentation, it's much more uncomfortable if you put it underneath the muscle where I think it should go, because the muscles are on stretch. They don't take a joke, they get over it. But the abdominal region, because there's so many muscles that you're tightening, it's the most uncomfortable. People who've had C-sections, say, is it like a C-section? I said, yeah, just add some more to it.
Wow, a little bit more painful than a C-section?
Absolutely, yeah.
Wow.
Because in the C-section, they're sewing the muscles back below the belly button and things. I'm doing it above, I'm doing it below, I'm doing it over here. Women would come back, and they'd have it again in a heartbeat. is such a
because
good operation.
it looks so good.
It does. I mean, after pregnancy, the biggest hit to a woman's body is pregnancy, no doubt. I think every woman recognizes that. And there's very few that basically end up with no stretch marks. I call them 2%ers, and
just 2%. That's it.
Yeah, everybody else ends up with stretch marks, and but their muscles will spread sometimes, and then sometimes they won't. I mean, if they don't have much muscle spread and they have good quality skin, and they have a little pooch below the belly button, then smart lipo is the way to go. But the ones that have stretch marks, I always kind of coach them into the fact that probably from an aesthetic standpoint of view and the way the skin will redrape, a tummy tuck is much better because you're taking off that extra skin.
And you can help them decide what's better for them, whether they want to have that lipo or that tummy tuck. What are some of the things that would help you decide the difference?
How much that muscle is spread out. They're coming in and they've got this big roundness situation. They'll come in and say, I got this roundness up here, and of course I got this extra skin down here. Can you liposuction that? Well, I'll push in the middle, and if I'm hitting something firm about this far underneath it, the muscles have spread apart. So I'll tell them, yeah, if you got good quality skin, we can liposuction all over. This won't change. Okay, and it's just the fact that basically I can't change the shape of those muscles just by doing liposuction. Men are the worst. Men will come in and they got this kind of pot belly looking thing. That's
kind of a problem area for men, the big round belly.
It is, but they'll come in saying, I want liposuction, and the whole thing will be just stretched out muscle, and they'll have about this much fat, and I'll say, I can't do anything for you.
It's not going to improve anything.
No, because that's intra-abdominal fat versus fat that I can get a hold of. And so I'll tell them they need to go on a diet, like an Atkins diet or something along the lines, to kind of get that intra-abdominal fat out of there. They'll be happier that way versus being disappointed with the results.
Now, we did talk about this on a prior episode, but I do want to touch on it since we're talking about summer-ready procedures. Laser hair removal. This is something that people need to think about right now because it does take several sessions to take care of, right?
It does. And again, this is a common procedure at this particular time. For the fact that most people don't have a tan, because the laser basically focuses on dark particles. If you got a tan, then basically you have dark particles that will absorb the laser, and sometimes it can cause some blistering. I haven't seen much of that. And in our office, we have the only one that basically has a dual laser that you can use on actually all skin types. Still have to be careful on those people who, the African Americans, people of color, just because that skin's a target.
Their skin's darker, right?
And we always use, a cool gel on top. Plus, we use this called a Zimmer, and it blows ice cold air on the surface of the skin because the hair follicle is deep. Okay, so you want to heat that up. You just don't want to disturb those cells that are on that very top layer of skin. But the two wavelengths has done a very good job in allowing us to treat all skin types.
And that is something that takes several procedures, right? I mean, you have to wait 6 weeks in between and go back several times before your hair will never grow back.
That's true. The main thing about it is, remember, any hair that you have, I don't care if it's on your head or other places, is only 60 to 70% of all the hair follicles. In other words, little bulbs that grow hair, that's available. And it's only those that have a shaft to them, okay, that you can actually injure. The ones that don't have any hair associated with at that time, they're not a target. Now they'll grow out, in 6 weeks, so they become a target. So, hair just rotates as far as, it's like any other kind of flower, like a tulip and things. It'll send up, a flower at a particular time of the year, then it'll die back, but the bulb's still underneath there. You cannot kill that bulb unless it has a flower on it or that hair shaft.
Well, we've talked breast augmentation, smart lipo, tummy tucks, laser hair removal today. The goal was to talk about procedures that are available to get ready for summer. Anything else you want people to know? We have about 1 minute left about any of those procedures or coming in for a consultation ahead of spring and summer.
Yeah, the consultations, again, for the smart lipo are real busy this time of year. Again, the smart lipo can be done in the office, without general anesthesia. So it's safe. We've had very good success with it. Smooth skin, tightened skin, which again I can't really accomplish just with regular liposuction.
Very good. Well, Dr. Bridges with Bridges to Beauty, if people want to have a consultation with you, what should they do? Where's your office and what do they call?
It's on Uri Drive. It's just south of Bromwood Baptist Church in the 318-219-8555.
Very good. Covered a lot of important information about summer-ready procedures. We hope it was very helpful to you. Thank you so much for joining us for this edition of Healthline 3.